to really give people the opportunity to look into our nursing careers that we have here in Coventry and Warwickshire Partnership Trust. And we do it in half-term holidays to allow young people in year 10 or year 11 to be able to join us. But also, we also want to welcome all the people that are here, are looking for a new career into nursing. So my name's Charlotte Sutton, everybody. I am talent manager at Coventry and Warwickshire Partnership Trust. So along with my incredible team, we support all of our existing members of staff to go on their career ladder of whatever choice they might have, whether that is nursing, whether that is physio, whether that's in admin roles. Our role is to help people develop from where they came into the trust, and if they want to, then we move on up. We also then want to attract local talent. So we want to attract people into the trust that might be thinking of nursing as a career. Now, there's been some bad press recently about nursing, about pay, about going various documentaries, and we wanted to kind of put that to bed today to show you what an incredible opportunity and an incredible career nursing is. And I've got some fellow colleagues on the call today that are going to talk about their particular nursing, why they chose their department, their service, and maybe talk about how they got into that particularly, what was their own career path. Please feel free to take some notes through the session. We don't have slides in a way that we have lots of PowerPoint. This is more about an informal chat from our nurses, letting you know what it feels like to be in that particular speciality. So please take notes. There is some information at the end about the apprenticeships that we offer within the trust. My team and fellow nurse colleagues will also be answering any questions that you've got as we go along. If there's some really interesting questions, though, my team might pick that out, and they might not necessarily have to say your name or anything, but if we think, oh, that's a brilliant question, we might bring it up and say, let's chat about that, because while we've got the professionals on the line, that's the best time to ask the questions. So you're here listening to Coventry and Warwickshire Partnership Trust. It's really interesting trust. We are community and wellbeing, we are learning disabilities, and we are also mental health services. And also we have our corporate hand as well. We have 4,000 staff, and we are located over 40 places. So we have clinics, we have respite homes, we have wards, we have outpatients, we have inpatients. We have some big hospitals, we have some small places where our patients either come in and stay overnight with us, or they come just to our day services. So full of variety, our trust, and we're extremely spread out through Solihull, through Coventry, through Warwickshire. And we do supply some services nationally, so people from all over the country come to our services, especially our Brooklyn site, which is in Marston Green. So really interesting trust. And I would recommend that if you're thinking to come and work for us, is to look on our internet pages to really get a feel of what our trust is about. We're not an acute service, we don't have an emergency, we don't have a midwifery, but we really do specialise in community nursing, mental health and learning disabilities. Okay, so our first nurses up are really good colleagues of Talent for Care. Both Grace and Sophie work really closely with us and going out to schools and sharing the nurse love. So if I could pass you over to Grace first, who's from Continence and Wound Healing, but actually new role, well, I say new, 12 months in, preceptorship facilitator. But Grace, if you could talk to us about Continence and Wound Healing, that would be marvellous. Thanks, Grace.
Thank you. Hi, everyone. I'm Grace Reynolds, the preceptorship facilitator for the Trust. My background is working within community health and wellbeing. I commenced my career as a district nurse and then chose to specialise into a dual role position as wound care and continence nurse. My passion really lay with continence care, so I went on to work solely in that one role. Within the continence service, we offer a lot of care for people who may have a bladder or bowel dysfunction. We were able to offer home visits or clinics, so we had a really varied way of working. So we had the privilege of going into people's homes and also then the autonomy of running our own clinics. I have to say, within CWPT, we have some really great training opportunities as well. So as part of my continence role, I was able to complete a further module at university to ensure I had the training to do this role. There's also the opportunity to continue your career further if you'd like to become, for example, a senior clinician within the trust, or if you'd like to go into management roles, for example, or the option to go somewhere similar to what I've done within the professional development team. So we support other nurses, nursing associates with training, support during individuals completing courses, and supporting students within placements. So it's a really great and varied role. But I'll pass over to Sophie, who's going to tell us a little bit about district nursing.
Thanks, Grace. So I'm Sophie Bolbracht. I joined the Trust 8 years ago as a healthcare assistant in community district nursing. I did that for about 10 months, and then I left to do my nursing at university for 3 years, and rejoined the Trust 4 years ago as a community staff nurse. I did that for 4 years, and I am now supporting the healthcare assistants in the Trust with their own development, predominantly onto the student nurse associate course. But I still do work in the community as well. Community nursing, some people still don't know that it exists or it's a thing. It's not sort of as widespread as your generic sort of A&E ward-based role. And it also gets a bit of a gets a bit stigmatized as just wound care. There is wound care involved, which is really important, but there's lots of different things that we do as well. So similar to Grace, we work in homes, so we're a guest in those people's homes, and we provide care for them to try and prevent like avoidable hospital and provide them with the care they need at home. So just an example of a few of those things, as I've said, wound care, we do a lot of continence and catheter care, bowel care, administration of medication, supporting people with their diabetes and insulin administration, and also a lot of palliative and end of life care, which is something I like particularly. Enjoy is the wrong word, but it's a massive privilege to be invited into somebody's home and support them and their family in the last stages of their life. So that's a massive part of district nursing, massive part of. And then, as Grace said, she then went on to specialise in one of those services that filters off from community district nursing. So there's a lot of variety, a lot of scope for furthering your skills, knowledge and development.
Thank you, Sophie, and thank you, Grace. Why did you guys choose community over acute nursing, general nursing?
I chose it just because I think you either love district nursing or it's sort of not for you and you prefer being in a ward-based setting, but I just prefer the autonomy, and you can sort of plan your own day. You're in charge of sort of, you know, your patients and how the decisions that you make, you're accountable. There is always obviously support on hand, but I also just find it a massive privilege to be invited into someone's home to provide them the care they need, and you can really develop those relationships whilst in people's homes. And you also get a 5-minute breather to pop the radio on in between the next person, you know, just to sort of reflect on where you've been and what you've been doing. So for me, it's just, I don't know, that's where my passion lies.
I think very similar, really. It is a privilege, and I think with my passion for district nursing, it then sparked my next interest of working within continence care and bladder and bowel dysfunction, especially being such a sensitive topic. It was something of interest in a way to help people with a area of care that they may not want to talk about or they may find difficult. So yeah, it's a great job, I have to say. It really is. You're part of a huge, great, big multidisciplinary team, but you're also working independently as well. So there's so many people you can link in with, such as like the mental health teams, our allied health professionals, so our physios, OTs, it really is a joint effort to keep people well at home.
That's amazing, Grace. Thank you. And then the last question that I have is, what kind of skills do you think people need to have to work in people's homes, in patients' homes?
I think you have to be someone who's prepared to work autonomously, to act in a professional way, to be non-judgmental, be respectful, and really uphold our trust values and our values as nurses.
Fabulous. And we have a question in the chat saying, what are the hours?
So in like community district nursing, this used to be sort of your short, like 8 till 4:30, but now that's changed. Similarly, like most things, some people do like 10-hour shifts. Some people do 12. It just depends now. It's changed.
We're very much as a trust looking into flexible working, aren't we, Sophie and Grace, to make sure that we've got enough nurses to look after the patients that we've got, but also to retain nurses that maybe have their own personal issues. It might be children, it could be dependent parents, etc. Or so we do really look at flexible flexible hours to make sure it fits in, but also the service and the patients are well looked after. So yeah, great question.
Hello Sophie, what did you do for the 10 weeks course you did before enrolling for the uni degree?
If I said 10 weeks, I'm sorry, I meant 10 months. 8 years ago they did a like scheme, it's called a pre-degree scheme, where they brought people in that didn't have much work experience in the healthcare setting into a healthcare assistant role within the trust. So that's what I did as part of that scheme, sort of see if I enjoyed it really. And then I left the trust, sort of become a full-time student and commence my training. I didn't know whether I'd come back here or not. That wasn't an obligation that I had to come back here. I could have worked anywhere, but I came back here and worked in the district because I loved it so much.
You talked about community nursing, working in continence or working in wound care or wound healing as it's called. So if you joined to come and work with them, would you just work specifically for that little area within the community, or would you sort of dip your toes in all of the various community services within your team?
If you work in a specialised service, it's just that service that you focus on and work with. So if you're in the wound healing team, you focus solely on wounds. And then similarly, as Grace said, if you work in the continence team, it's bowel and bladder continence issues.
Thank you, Sophie. Thank you, Grace.
Thank you.
Right, over to community nursing mental health, and I would love to introduce Donna Luck, our transformation clinical lead for community mental health services. Hi, Donna.
Hi Charlotte, you okay? So I'm not degree trained or anything. So I started my nurse training, my mental health, my RMN training back in 1991. Those were in the days where you had one academic assignment to submit every year. So based on today's standards in terms of eligibility criteria, I don't have maths GCSE O level, so I wouldn't be able to get into nursing today. Anyway, so back in the day, I've had the privilege actually of training within an old psychiatric hospital. So I've been able to see how mental health nursing has been since the early 90s. And prior to that, come from a bit of a family of mental health nurses. So I've got a kind of a good narrative of how mental health nursing used to be and how we do things today, and how things have massively changed and improved, and obviously become a lot more complex, and the demand has massively grown. So I predominantly worked my career in community mental health. Once I qualified, I moved to Coventry. So I've been not in CWPT because obviously I've worked in different guises. It's sort of, I worked in Coventry up until 2006 when we combined as the different trusts. So I have worked in this sort of region ever since. I did my 3 years on the wards on inpatients. So in terms of what we provide in terms of mental health nursing, we have our inpatient acute service, we have our urgent care, which tends to be things like AMHAT, which is A&E liaison, our home treatment access hubs, and mental health street triage. So I did 3 years inpatients. It actually wasn't until, like what Sophie and Grace are saying about working in the community, wasn't really until I started working in the community that for me, that was what mental health nursing was all about. It was that providing that holistic care to the person in their environment, their home, with their family. And for me, that was a game changer. And I have not left community ever since, and nor would I entertain ever leaving community. So all through my career as a community mental health nurse, I've tended to work primarily in specialist services, so providing intervention support, caseload management to people specifically with serious mental illness, usually people with psychosis. As a result of that, I've gone on to manage specialist community mental health teams such as assertive outreach, early intervention in psychosis teams. I started my career as a manager in 2008 or 2006, one or the other, I can never remember. And again, that was sort of building on my expertise and experience of working as a mental health nurse, working within that multidisciplinary approach, and just sort of generally just graduating into that sort of team manager role. And I think there was that sort of tipping point where you love working with the patients, but actually you see that actually I can start to make a difference in different ways to that patient journey, and, setting up teams and working with teams and processes. So I am where I am now as a clinical transformation lead. As I said, I've worked in community services here since 1996. We're going through currently in Coventry and Warwickshire Partnership Trust, along with many other trusts, a huge community mental health transformation where we're really starting to align our primary care, working with GPs and our specialist services together. And I guess for me, going into that role was that sort of, I've got a good sort of understanding of where we've come from over the decades within community mental health. I've seen what I've seen. I know where we've come from, and, I guess I'm part of a team where we know what the vision is and where we need to go forward within community mental health. But for me, it's always been a massively rewarding job. It's probably one of the most challenging careers I think you can have at times, working with people with mental health problems. The demand is absolutely sort of outstripping the resources that we've got. We're having to work really, really creatively out here, creating different posts where we're able to deliver interventions that people need. For me, the face of mental health nursing has really changed over the years as well. We're kind of moving away from those real serious mental health issues, people of chronicity, because actually we are putting in services earlier on, people are getting earlier treatments, and actually the client group that we're seeing, the demand that's growing is sort of our younger group of people now, and lots of experiences of trauma that people are having, struggles managing their emotions. So it kind of feels like it's less around those sort of chronic psychosis patients to really just offering a service to a lot of people that are out there struggling with how we're living our lives and the pressure of our lives in today's society. What I love about mental health nursing as well is the kind of different specialisms that you can go into, whether that's forensic psychiatry, eating disorders. For me, early intervention in psychosis was always my favourite specialism. There's just a lot of, children and adults. So there's a good range of specialism that you can sort of go into and develop a career in. But in terms of sort of, for me, seeing people out in the community as well, a little bit like what Grace and Sophie, the same skills are very much needed, really those interpersonal communication skills, that real compassion, tolerance, resilience. Community mental health nursing sometimes means going into people's homes that don't want you there, that don't want a service. So you have to really, your communication skills and your compassion has to be sort of paramount, and sort of how you work with people that, sometimes really do not want a service from us.
Donna, what are some of the roles the new roles that we've got out there then? So obviously I know about the homeless pathway. That's really interesting stuff, isn't it?
Yeah, so that is a new pathway. So we're putting in lots of different sort of almost specialist pathways. A lot of them are sort of psychological based. So a lot of the sort of new roles are outside of nursing roles. And those are sort of your sort of mental health wellbeing practitioner type roles, assistant psychology roles, in order to be able to deliver interventions. And that's to kind of bridge the gap around the shortage of nurses that we are currently seeing. But there's lots of opportunities for nurses to train in specialist interventions, such as DBT therapy, other psychological interventions. We've got CBT specialists and therapists. So you can veer off into different sort of career pathways, whether it's sort of management or whether it's a clinical lead or whether it's delivering specialist interventions. And courses are often available. In fact, probably the ability to have courses available is more than what we've got in terms of staff. Sometimes we have to turn those courses down because we haven't got the staff to be able to send on them. So we really do, work to try and upskill some of our nurses to be able to deliver the interventions that our clients sort of in today's society need.
But that must change all the time as well, Donna, for the different training and what the patients need. Would you mind just explaining what CBT and DBT is, please?
Yeah, so CBT is cognitive behavioural therapy, and that's just a psychological intervention that we can give to people with a number of different disorders, but mainly anxiety, depression. But there's sort of the services that I've managed. We can do a specialist CBT therapy course for people with psychosis. You can do a specialist course for people, CBT for people with a personality disorder. And it is a 2-year course. It's a therapy course. It usually involves a promotion at the end of that course. DBT is the same thing. That's dialectical behavioural therapy, and that's for people with a personality disorder.
Wow.
It has massively increased over the last 10 years that I've been working in psychiatry, and people struggling out there to manage their emotions. So those are the sort of high-end, more intensive psychological interventions that we deliver. And as we're going forward, transforming community mental health services, we are whereas we've always been classed as secondary care in mental health, we are now kind of rebranding it as specialist interventions. And again, that's a range from your softer, low-end interventions that can be delivered by lower graded practitioners to your high end that need to be delivered by trained psychology staff or therapists. So it's a whole kind of menu of interventions, and through the transformation we are increasing that menu of interventions, but we're also offering it to a wider range of patients. So in mental health we tend to put, just the way we've configured things, we've tended to put people in boxes, diagnostic boxes, and that's not the world we live in. People have lots of different, their mental health condition, there's lots of comorbidities there. Someone with an eating disorder is likely to have high levels of anxiety or low mood or some emotional dysregulation. So we need to offer a menu of interventions that is able to meet somebody's presenting need, not just their diagnosis. So I think in some ways, that's the biggest way that we're moving forward. We're going from being a diagnosis-led community service to what is it the patients need, what interventions do they need, and it's about getting those interventions to them at the right time with the right practitioners to do that. And obviously nursing is a massive part of that.
That's amazing, Donna. Absolutely, so interesting. It's really good to hear from a community point of view. It's really, really interesting. I know there were some questions in the chat. Faith, would you mind picking them up for me?
No problem. So the first one is, did you find it difficult to switch off from work at the beginning?
At the beginning in the 90s, or?
I'm not 100% sure. That's just what the question says. So I'm guessing from when you first started.
Yeah, dealing with patients that are properly poorly, I suppose, then going back to your life, Donna, I suppose.
Yeah, I think it's like anything. You have to get used to that. You have to become resilient to it, and you have to kind of learn to switch off a little bit. And interestingly, when I used to work in patients and moved to community, a lot of staff didn't entertain the idea of working in the community because they didn't like the idea of kind of when you work on a ward, you hand the keys over, you leave it to the next shift. And a lot of people didn't like the idea of you've got a caseload of patients. When you clock off duty, they're still your patients as such. And it was that kind of concept of risk and kind of managing those patients on your own. But it's like anything, you get used to it, you work within the parameters of what you can, and you follow procedure, and you do the best, and you work as part of a multidisciplinary team. So no, to be honest, I struggle now with the way that we're working with remote working and being able to work from home. So it's probably at this point now in my career that I struggle to switch off the most.
Thank you, Donna. So the next question that we've also got in the chat box now is, how would my own mental health diagnosis affect my ability to become a mental health nurse?
Oh, wow. This is one great area of the transformation now, is that we are really kind of working in a very different time. This is where we are doing a hell of a lot of work with people that are experts by experience. We are also working with people that are experts by profession and experience. And it's really weird because over the years, we were told back in the day, if you had any mental health problems yourself, you didn't disclose that. You certainly didn't talk to a patient about it at all. And now we're working in a very different world where we've got peer recovery workers that are people that have been in receipt or still are in receipt of services that are now working within our community mental health teams. And actually, we are embracing that. And actually, those people that have got, experience, by having a mental health and a profession, in some ways make the best professionals, because they're able to sort of empathise from both perspectives. So we are completely living in a world now where we are embracing that and welcome people that do have that experience to come into mental health nursing or into the NHS nursing as a whole, in any of the roles that we can offer in mental health. So I'm currently working within the transformation with a Band 7 who is in that role as an expert by experience. So she's working as part of the transformation, working at how we kind of change the culture and the attitude, and basically is bringing to that transformation the patient journey. So all along, whatever we're transforming and operationalising, it's keeping in mind what this means for the patients, how this is going to impact on the patients. So yeah, this is, absolutely embrace people that have had those experiences. And also those of us that have been in the job long enough, you don't come across many that haven't had some kind of mental health experience. We're human, and there's a lot of mental health problems out there.
Okay, thank you so much, Donna. That was really amazing. I love listening to you. That was wonderful. Thank you. So hi, Vicky or Victoria, I don't know which one you prefer, from community nursing, learning disability and autism. Hi, hello. Vicky, do you prefer Vicky or Victoria?
Vicky's fine.
Vicky's fine. Okay, lovely to see you, Vicky. Over to you, talking about learning disability and autism. Thank you.
Okay, hello everybody. So I'm Vicky. I've just rushed back from a shift. I was stuck in traffic, so I'm sorry. But just to say, so I've been qualified, so not that long really, but 7 years. I started out in a rotational post, so which was like children's respite, but then I did some time in special schools, and I moved to eating disorders for 6 months to cover like a post there. So quite different. I learned a lot clinically at eating disorders, probably a bit more, I guess the word, because I went straight from, sixth form. So I guess probably like developed maturity wise, going around a few different places. But I think I soon found that my niche was respite and children at the time. So I did that. And then I moved on to Zoe's Place, end of life care, but also respite. So I think a lot of people think of it as just end of life, but it's actually, a complete mix. And the reason that I did that is because I don't know about how other people feel, but when you go to uni and you do LD nursing and autism, you don't see so much of the clinical side sometimes. You might do, depends what placements you get. And I think that has got better over the years. And people are becoming more complex, I guess, that we have on our caseloads now. So I went to Zoe's Place. At the time, I didn't have the skills to be there. But they allowed me to go and learn. So I went into ventilation with children, tracheostomy care, catheterization, and a lot more clinical, as I say. Then I did do a lot of end of life, particularly with babies. Really, really difficult, but absolutely loved it. The only reason I left there was actually because of the financial struggles they had, and that, I had a family and I needed to be safe. So I went back to the NHS, if you like. And
went back into respite in the NHS in adult, and I've literally in the last like 4 or 5 months moved to special school nursing. So I very new to me, but I always liked the area of school from when I was newly qualified, and knew that that was something I'd love to do in the future. But you're very on your own, so I think I knew that I wanted a few years experience first, and that's kind of where I'm at. I do NHSP all over still, respite everywhere, because I think you keep your skills. So that's where I've just been today at an adult respite, Shirley House, so some people might know it. But so yeah, I think that's kind of me in the 7 years, but my background predominantly is respite, and I think with that you come across all different types of LD, from severity of, you know, people are able to do their things, they just need a bit of prompting and a bit of support in that way, and it's actually enabling the environment for them, down to completely using sign language, pictures, they need hoisting, and every care need met. So there's, you know, severity of that, and I guess that's, you know, my background a little bit there.
So Vicky, did you graduate as a learning disability nurse then?
Yes, yeah, I am a learning disability nurse. So when I went to Zoe's place in particular, there was mainly children's nurses there, and only 3 of us were LD. And it's actually very similar in the schools. It's kind of half and half. Some are children, some are LD. And I think you find that with mental health as well. So at the respites I've been at, a lot of them have had mental health nurses, because you tend to find that, particularly Shirley House, for example, I was there for a few years. So they've got a unit that's like complex health, which I was kind of the lead on. But at the same time, I worked on the behavioural unit as well. But the mental health nurse might be the lead on there. And you just, I think that's kind of how nursing probably has become, yeah, back to the olden days, I guess, a little bit more. Like I refer back to my mother-in-law who qualified, and she did a mixture of every nursing.
Yeah.
I think that kind of comes with time. So although I'm LD nurse by background, I, you know, very strongly about autism, and that's kind of what I do love. But I'd say that I work with a lot of nurses now in different, you know, I think it's kind of what you put into it as well at the same time.
And I suppose that's evolved over time, hasn't it, Vicky? That you
Yes,
thought you might be
definitely.
wanting to go one way, but then a different pathway comes along your way.
Yeah.
So
yeah.
when you go into schools, do you visit one child, or do you go to school with that one child, if that makes sense?
So there's a continuing care team that I don't know if somebody else talked about. They might go as a one-to-one with a child, and that's kind of their role. But no, so the school nursing team, there's like say there's 10 of us. You have 2 schools. So I'm part-time, but if you know, do 5 days a week, you might have a 3rd school. But so I have a main school, which is Baginton Field School, and then I have a 2nd school, which is Sherborne. So I'll be at Baginton probably, I could be there for 3 weeks straight, and then Sherborne might need some cover for sickness, or they might need someone who specifically needs a type of catheterisation that's new and I've done it before. So they might say, well, can you go there for that day? And we try and cover it like that. So I do 3 sole days a week at Baginton, and you are in and out of different classrooms. At that school in particular, there's 2 clinical classrooms, and the rest are much more behavioural. So I might go to them more to manage behaviours if they needed a dose of something. You know, it just depends.
Okay.
Or if they have a seizure. But I've got children in classes that, you know, might have a stoma bag. They have like peg and jed feed. So it will and I'm with them every single day in and out of the classroom. So it will just depend. But then Sherborne is a lot heavier clinically, so there's a lot more children on the books there that need a nurse quite regularly. So your days are very different, but at the same time you have got a bit of a pattern of, you know, when they need their feed and their meds and everything, you know.
You're using a lot of skills then, aren't you? Rather than just the learning disabilities, you've also got your clinical skills as well, I suppose.
Yeah, definitely, yeah.
Wow. So what kind of skills do you think you need then to go into learning disability and autism nursing? What skills do you think what would be your top 3?
I think probably openness and like honesty, if you like. You can never predict a situation. So I think often how we respond to certain situations that they might shock us, but it's how we deal with them. I can, like, for an example, like you know, if a new child comes to respite for their first tea visit before they're about to stay over, that obviously is quite big for somebody new. It's a new environment, they could be quite anxious, missing parents or carers, and I think how you know, portray your feelings, and you can heighten them, or you can bring them down if you like, and you can try and manage it. So I think that's a big one. I think massively, obviously, like a non sort of judgment, and I guess the thing is to always think of that person having capacity and an ability. It's just we've got to find it, and we've got to find what's right for them, if you like. Because you can work with, like I say, somebody whose needs are totally different in the morning to the afternoon, but it's just we can do the same thing with them and get to the same level. It's just about that. So I'd say that's very big. And I'd say it is about confidence. I think a lot of the time, if we're dealing with people who haven't got the capacity to tell us something, or they're unable to say it, you are their voice. And I think it's really important to try and, you know, help get every aspect that they can, or any, you know, sometimes families will say, oh, I didn't know I could get this DLA or whatever it is.
Yeah.
And you say, oh, you know, and it's sometimes being that person that's confident enough to say, well, you can try this. And that's the same with obviously us trying to speak up for people with learning disabilities, if you like.
So when you train to be a learning disability nurse, do you then choose after that to become with children's or adult? Is there a particular nurse training that you do to do different ages?
So no, I mean, children's placements are a lot harder to find, and I'll be honest, in uni a lot of people wanted to do children or try a children's placement. I actually only had one very short children's placement, despite, you know, I'd like the idea of doing it. So for me, my background, I'd always known adults really, but I always thought, you know, I'd like to try it. But the thing is with LD is that there isn't really a set, you know, so you can kind of do whichever at the end. I think a lot of people have their sort of like forte where they love adults, love children. I'm somewhere in the middle, and obviously I've gone back to children. I've done a lot of children since I've been qualified, but I actually think there isn't that much difference sometimes. And yeah, but I did go to uni with people that solely wanted to work with children. So yeah, I guess, but you can choose either way or change your career pathway in that way.
That sounds full of variety. Whereas
Yeah.
obviously normally if you want to work with children, do a children's nurse, you kind of choose that before you start your degree. So with
Yeah.
learning disabilities, it sounds like there's more variety there in regarding
Yeah.
that you could choose both different ages. Whereas I suppose in mental health there's that as well. You could go down the CAMHS route or adult mental health. So
Yeah.
I've never thought of it like that, Vicky. So that's really
Yeah.
interesting to hear from that point of view. So can you see this being your career for the next few years? Do you see changes, different pathways that you would like to go to or go along to?
I think now I'm in the school, I think it will be my career for quite some time. It took me a little while to change because I've done a lot of respite, but I would say that I think the school is expanding. So as I've said, we get more and more complex children now. So it means there's still lots to learn all the time. So I'm doing, like I say, a lot of stoma care at the moment. I hadn't done that since probably when I'd been qualified a year or two. It's been a long time. So I think for me, I'm quite happy to sort of, I've reached to where I'd like to be at the moment, and that's where I kind of would be. I historically did do some deputy management at a respite, but since I've had 2 young children, I've almost taken a little bit of a step back, if you like. Yeah. But it's a sideways move, I guess, and it's what, you know, I wanted to do, eventually go to school. So I think, yeah, I'm enjoying that at the moment.
But it works for you at this moment, Vicky, doesn't it?
Yeah,
so it goes back to me saying about the flexibility is there if a family is what you want, or we've got adult parents to look at. Well, there will be adult, they're parents, but you know, grown adults, I mean. So I think that's a brilliant, you know, how you're saying that is shows the different flexibility we can do being a nurse within the trust. So yeah,
because I'll be honest, before this I've always done shifts. I've always known nights, weekends, everything. So to me, to go to like term time job is a bit like, whoa, like kind of, yeah, but it does show that it is out there are options.
No, absolutely. Yeah, there's some comments in the chat about they didn't realize they could make some changes, because not only can you change the way forward in regarding nursing, there's also management and leadership qualifications you can get to, like what Donna was saying about managing and leading teams if you do want to move away from the clinical side. So
yeah, definitely.
Thank you, Vicky. That was absolutely amazing. Really nice to meet you. Thank you for that, Vicky.
Take care.